Vitamin D, often referred to as the sunshine vitamin, has garnered significant attention in recent years due to its vital role in maintaining overall health. From bone strength to immune support, this essential nutrient plays a critical role in our well-being. However, alongside its growing popularity, a whirlwind of myths, misconceptions, and debates has emerged. This video aims to explore the truth about vitamin D, covering its benefits, sources, recommended intake, and the controversies that surround it. Vitamin D is a fat-soluble vitamin that is crucial for the absorption of calcium and phosphorus in the body, which are essential for maintaining healthy bones and teeth. Unlike other vitamins, vitamin D functions more like a hormone, influencing various bodily processes, including immune function, inflammation regulation, and cell growth. There are two main forms of vitamin D. Vitamin D2, ergocalciferol, found in some plant-based foods and fortified products. Vitamin D3, cholecalciferol, produced in the skin when exposed to sunlight and found in animal-based foods. The health benefits of vitamin D. Vitamin D is best known for its role in promoting bone health. It helps the body absorb calcium, which is necessary for building and maintaining strong bones. Without sufficient vitamin D, bones can become thin, brittle, or misshapen. In children, a deficiency can lead to rickets, a condition characterized by soft and weak bones, while in adults, it can result in osteomalacia and contribute to osteoporosis. Recent research has highlighted the importance of vitamin D in supporting the immune system. It enhances the pathogen-fighting effects of monocytes and macrophages, white blood cells that are important parts of your immune defense, and decreases inflammation. Some studies suggest that adequate vitamin D levels may reduce the risk of viral infections, such as the flu, and potentially improve outcomes in diseases like COVID-19. Vitamin D receptors are present in areas of the brain involved in mood regulation. Some studies have linked low vitamin D levels with an increased risk of depression and other mood disorders. Although more research is needed to fully understand this connection, maintaining adequate vitamin D levels may play a role in mental health. There is growing evidence that vitamin D may help in the prevention of certain chronic diseases. Some studies suggest that higher vitamin D levels are associated with a reduced risk of conditions such as heart disease, multiple sclerosis, and certain types of cancer, including colorectal cancer. However, these findings are still being studied, and not all researchers agree on the extent of these benefits. Sources of vitamin D. The most natural way to get vitamin D is through exposure to sunlight. When the skin is exposed to ultraviolet B, UVB, rays from the sun, it synthesizes vitamin D3. Just 10 to 30 minutes of midday sun exposure several times a week can often provide enough vitamin D for most people, depending on skin type, geographic location, and time of year. While sunlight is the most significant source of vitamin D, certain foods can also contribute to your daily intake. These include fatty fish, salmon, mackerel, sardines, and tuna are rich sources of vitamin D. Fortified foods. Many foods, such as milk, orange juice, and cereals, are fortified with vitamin D. Egg yolks. Eggs, particularly the yolks, contain small amounts of vitamin D. Mushrooms, some varieties, particularly those exposed to sunlight, can provide vitamin D too. For individuals who have limited sun exposure or dietary intake, vitamin D supplements can be an effective way to ensure adequate levels. Supplements are available in both D2 and D3 forms, with D3 generally being more effective at raising blood levels of vitamin D. Recommended intake and safe levels. The amount of vitamin D a person needs can vary based on age, gender, and health status. The Institute of Medicine, IOM, provides general guidelines. Infants, 0 to 12 months, 400 IU, international units, per day. Children, 1 to 18 years, 600 IU per day. Adults, 19 to 70 years, 600 IU per day. Adults over 70 years, 800 IU per day. Pregnant and breastfeeding women, 600 IU per day. However, some experts argue that these recommendations may be too low and suggest higher intakes, especially for individuals at risk of deficiency. Upper limits. The IOM also sets upper intake levels to prevent toxicity. Infants, 0 to 12 months, 1,000 to 1,500 IU per day. Children, 1 to 18 years, 2,500 to 4,000 IU per day. Adults, 4,000 IU per day. Excessive vitamin D can lead to hypercalcemia, a condition characterized by too much calcium in the blood, which can cause nausea, vomiting, weakness, and serious complications like kidney damage. Controversies and myths surrounding vitamin D. As discussed, some believe in a vitamin D conspiracy, where the benefits of vitamin D are allegedly suppressed by pharmaceutical companies and health organizations to protect profits from chronic disease treatments. While there is no substantial evidence to support this conspiracy, it has fueled debates and skepticism. There has been considerable debate about the role of vitamin D in cancer prevention. Some studies suggest a protective effect, while others find no significant association. The inconsistency in research findings has led to ongoing debates in the medical community. While vitamin D's role in bone health is well established, its effect on cancer remains an area of active research. While rare, vitamin D toxicity is a genuine concern, particularly with high-dose supplementation. Unlike water-soluble vitamins, excess fat-soluble vitamins like vitamin D can accumulate in the body, leading to toxicity. It's important to adhere to recommended guidelines and consult with a healthcare provider before taking high-dose supplements. There is growing concern about a global vitamin D deficiency epidemic, with many people not getting enough of this essential nutrient. Factors such as limited sun exposure due to indoor lifestyles, sunscreen use, and living in northern latitudes contribute to this deficiency. Some health experts call for more aggressive public health strategies to address this issue, while others caution against oversupplementation. The balanced truth about vitamin D. Vitamin D is undeniably important for maintaining overall health, particularly for bone strength and immune function. While there is promising research suggesting additional benefits, including chronic disease prevention and mood regulation, these areas require further investigation. It's crucial to maintain adequate levels of vitamin D through a combination of sun exposure, diet, and supplements if necessary, but also to be mindful of the risks associated with excessive intake. Rather than buying into conspiracy theories or extremes, the best approach is to stay informed with evidence-based guidance and consult with healthcare professionals to determine the right vitamin D strategy for your individual needs. Understanding the truth about vitamin D empowers you to make informed decisions for your health and well-being.